Hi everyone, and welcome back to the Sports Therapy channel. In today's video we're going to be talking about one of the most common running injuries, runner's knee. Now if you've ever felt pain in and around your kneecap during or after a run, then you're not alone. But don't worry, because in this video I'm going to explain what causes it and most importantly what we can do about it. So stay tuned. Runner's knee, or patellofemoral pain syndrome as it's medically known, is a condition that causes pain around or behind the kneecap. It's often linked to overuse and improper biomechanics or muscular imbalances. Basically, the kneecap isn't tracking correctly in its groove, and often that can cause irritation, pain and inflammation. However, runner's knee doesn't just affect runners. It can also affect cyclists, hikers and even people who sit for long periods of time during the day. But it's usually runners who get this condition, as it's triggered by repetitive stress on the knee joint. Symptoms of runner's knee can include a dull aching pain around or behind the kneecap, pain that worsens with activity like running, climbing stairs, squatting or sitting for long periods of time, and sometimes you might even hear a grinding or clicking noise when you get up or bend your knee. If you experience any of these symptoms, it's important that you address them early on, as ignoring them can lead to more severe problems later on down the line. Runner's knee can have several underlying causes, including overuse, so logging too many miles too quickly without proper recovery. That could also include increasing intensity or changing surface too soon. Weak hip or quad muscles, as these muscles stabilise the knee, and if they're weak, your kneecap might not track correctly. A tight IT band or calf muscle, as tightness in these areas can pull on the knee, increasing stress to the area. And poor running form, such as overstriding, excessive pronation or an imbalanced gait during the run cycle, can also contribute. Even your running trainers can play a part, because if they're old or not suited to you, they can put extra strain on the knee, again increasing the injury risk factors. Okay, so now let's get to the good stuff. How can we prevent runner's knee? So first and foremost, strengthening your muscles is always a good place to start, and the main focus here are on muscles like the quads, hips and glutes, so exercises like step ups, clamshells and glute bridges are all great for this. Stretching regularly, so loosening off the tight areas like the IT band, hamstrings and calves with static and dynamic stretching can all be useful. It's worth mentioning though that when you do dynamic stretch, make sure you do that pre-run and leave any static stretching post-run. It can also help by improving your running form. So shortening your stride length so that your foot lands underneath the hip to reduce stress on the knee has also been proven to help minimise injury risk, and a gradual progression. So following the 10% rule, so not increasing the volume of your mileage by more than 10% per week. And don't forget rest, as rest is key. So if your knee pain is persistent and causing you major problems, take a few days off running and let your body recover. And if it doesn't seem to improve, then come and see a sports therapist or a physiotherapist in your area. And if you happen to be in the Coventry or Warwickshire area, you're more than welcome to come in and book in and see me at Sports Therapy 1 by visiting sportstherapy1.com, having a look at the services we provide and booking online. Another key tip is to check your running trainers. Make sure they're not worn out and that they provide the right level of support for your foot type. So that's it for today on runner's knee. Remember, it's not something that you have to live with, and by following these tips you can get back to pain-free running in no time. If you found this video helpful, make sure you give it a thumbs up and hit the subscribe button. That way you'll get more injury prevention advice. And do let me know in the comments if you've had to deal with runner's knee yourself, what helped you recover. We'd always love to hear your stories. And until next time, keep running and we'll see you on the next one. Bye for now.